Gabapentin, a medication primarily used to treat seizures and certain types of nerve pain, belongs to the class of drugs known as anticonvulsants. It is marketed under the brand names Neurontin, Gralise, Horizont, and Gabapentin. Gabapentin has garnered attention not only for its therapeutic benefits but also for its potential side effects and interactions. Gabapentin was initially approved by the FDA as an adjunctive treatment for partial seizures in adults with epilepsy. It helps in reducing the frequency and severity of seizures by stabilizing electrical activity in the brain. It is prescribed for the treatment of neuropathic pain caused by conditions such as diabetic neuropathy, postherpetic neuralgia or shingles, and trigeminal neuralgia. Gabapentin is sometimes used off-label to alleviate symptoms of restless leg syndrome, a neurological disorder characterized by an uncontrollable urge to move the legs. One of the most frequently reported side effects of gabapentin is dizziness and drowsiness. These symptoms can impair a person's ability to concentrate or operate machinery safely. It can lead to tiredness or fatigue, impacting daily activities. It may also cause swelling in hands, feet, or ankles due to fluid retention. Gabapentin can result in nausea, vomiting, diarrhea, or constipation. Some individuals may experience weight gain while taking gabapentin. Gabapentin might affect mood, causing irritability, agitation, or depression. It may also cause muscle tremors or coordination difficulties. Rarely, gabapentin can trigger allergic reactions such as rash or swelling. Gabapentin has been associated with an increased risk of suicidal thoughts. Abruptly stopping gabapentin can lead to withdrawal symptoms like anxiety or nausea. The precise mechanism through which gabapentin exerts its therapeutic effects is not fully understood. However, it is believed to involve modulation of calcium channels in the nervous system. Gabapentin's ability to bind to the alpha-2 delta subunit of voltage-gated calcium channels in neurons may reduce the release of neurotransmitters, thereby dampening abnormal neuronal firing associated with seizures and neuropathic pain. The dosage of gabapentin varies depending on the condition being treated, the patient's age, medical history, and other factors. Gabapentin is available in different formulations, including capsules, tablets, and oral solutions. When used for epilepsy, the starting dose for adults is 300 mg orally 3 times a day, and it can be increased to a maximum of 3,600 mg per day. And for children, the starting dose is 10 to 15 mg per kg per day, and it can be increased to a maximum of 40 mg per kg per day. When used for neuropathic pain, the starting dose for adults is 300 mg orally once daily, and it can be increased gradually to maintenance dose. The maximum dose can go up to 1,800 mg per day in divided doses. When used for fibromyalgia, the starting dose for adults is 300 mg orally once daily, and it can be increased to 300 to 600 mg twice daily. The maximum dose can go up to 3,600 mg per day. When used for restless leg syndrome, the starting dose for adults is 300 mg orally once daily in the evening. The maximum dose can go up to 600 mg per day in divided doses. When using gabapentin, it's crucial to be aware of certain warnings to ensure safe and effective use of the medication. It can lead to suicidal thoughts and behavior. Monitor for mood changes, especially at the start of treatment. Inform your doctor about all medications you're taking to avoid drug interactions. Taper off gabapentin gradually under medical supervision to prevent withdrawal and dependence. Adjust dosage in patients with kidney problems. Be cautious if you have respiratory issues, especially with opioids. Avoid driving or operating machinery if you feel dizzy or drowsy. Seek medical help if you experience rash, swelling, or difficulty breathing. Discuss risks with your doctor if pregnant or breastfeeding. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.